Morning, sir.
Morning.
My name is John. What's your name?
It's Jesse.
Jesse, nice to meet you.
Nice to meet you.
I'm a paramedic student. What brings you in today?
I need a yearly physical for work.
Okay. And have you had a physical before, Jesse?
Yeah, yearly.
Okay, so you know what it encompasses?
Mm-hmm.
So I'll just review our process here. I'm going to start by asking you just a few simple questions about who you are. Then we're going to get into medical history, and we're going to follow that with a hands-on physical assessment. So any questions or concerns about that?
No.
Perfect. What's your full name, Jesse?
It's Jesse Daniel Cyphus.
Okay. And what was your date of birth, or what is your date of birth?
August 12, 1990.
Okay. And where were you born?
Red Deer, Alberta.
Perfect. Do you have any allergies, Jesse?
No allergies.
No allergies. And are you on any medications at all?
No.
And any past medical problems, concerns?
I'm
I don't know. Healthy guy. How old are you?
26.
26. And what was the last thing you had to eat?
I just breakfast sandwich from McDonald's.
Okay. And the events leading up to the physical?
I woke up. I booked this, so I had my coffee, my breakfast sandwich. I drove Sunday traffic, and I got here.
So moving on into the family history, do you have any family history of medical problems?
Heart problems on my mother's side, heart attacks,
Okay.
and dementia on my father's side.
And grandparents, are they still living?
Two of them are, one on each side.
And do you have any siblings?
I have 3 siblings.
And there are 2 sisters?
One older brother, one younger sister, one younger brother.
And they're all in good health?
Good health.
And just moving on to a social history, do you drink, Jesse?
Yeah.
And if you had to put a number on it, no judging, how much would you say you drink a week?
4 or 5 beers.
And is that all at once or spread out?
Spread out through the week, sometimes a couple in a day.
Okay. And any drugs at all?
No drugs.
And are you a smoker?
I evap.
EVAP. Okay. And what do you do for work?
I'm a firefighter, paramedic,
Perfect.
city ranger.
How long have you been doing that?
2 years now.
And you happy with your job? You enjoy it?
Yeah, I like it. It's a good job.
And your relationships with your family, everything's good?
Yeah,
Good relationship.
Yeah.
Okay. Unless you have anything more to add, that concludes this part of the history.
Okay.
What I'd like to do now is I'll have you stand up, and I'd like to check your height and your weight.
Sure.
Alright, so we about 200 pounds there.
200 pounds, yeah.
Okay, and let's get a height on it. And oh, 6'3"? 152.
160.
162.
Yeah.
That puts you over 6 feet, eh?
Yep.
Okay, thank you. So the next thing I'd like to do, I'm going to check your vision here with I have what's called a Snellen eye chart, and this tape is 20 feet back.
Okay.
So what I want you to do is cover your left eye, and I want you to read the lowest line down that you can read with your right eye.
Okay.
Go ahead.
DEFPOTEC.
Perfect. And if you just cover your right eye and do the same thing.
DEFPOTEC.
Okay. So 20/20 vision. I'll just have you sitting down here again, Jesse. What I'm going to do is just check your blood pressure, check how much oxygen you're getting in your blood, and take a quick tracing of your heart.
Okay.
So for the heart tracing, I'll need you to remove your shirt, and I'm going to put on a pair of gloves for this. Have you had a 12 lead done before?
I have.
And no concerns?
None that they told me about.
Okay. Feel your arm tighten up there. Gonna check your temperature. If you have any questions or concerns at any point, just let me know, okay?
Okay.
36.6. No fever. So, need a finger from you. So this just measures how much oxygen you have in your blood. Alright, so blood pressure of 114 on 70, that's great. Pulse is 64, and your oxygen sats are almost 100, 98%. So this next part, I'm going to put some electrodes on your chest. The gel feels a bit cool. Just allows me to get a good picture of your heart. See it's in good working order. I'm not going to shave your chest, but sometimes.
You have very gentle hand.
Thank you. Alright, any questions or concerns up to this point?
None right now.
I was just gonna.
We're moving on right away.
It'll screw up your video. Just in case it's all coming.
So while I'm doing this, I'll just explain, it's quite a sensitive test.
Okay.
So after I've entered your age and your sex, I'll just have to have you be nice and still. Okay. So you said you're 26 years old?
26.
Okay, nice. Okay. Feel free to move. And last thing here, for your vital signs, I'm just gonna check your blood sugar.
Okay.
Just borrow one finger here. Okay, a little poke in your finger. 1, 2, 3. Excellent. Blood sugar is 6.8.
Okay.
So everything's coming back very, very good right now, okay? So I'm going to pack up. I'll let you get your shirt back on.
Sure.
And we'll proceed with the assessment, alright?
Okay.
There you go. Excellent. Your heart tracing looks good. Good blood pressure.
Good.
Get lots of oxygen in your blood. And I'm just going to get this out of the way. Alright, Jesse, so for the next part of the exam, we're going to start our head to toe exam.
Okay.
And what's going to happen is I'm going to be looking and feeling most parts of your body, performing a few tests, and just asking you a few simple history questions while I do it, okay?
Okay.
So, first thing is, have you ever had any headaches, or do you suffer from?
Like the odd headache, but no.
Yeah, it's not a frequent.
Not a frequent by any means, so.
Okay. And have you ever had any dizziness or lightheaded?
No.
Have you ever passed out?
No.
Okay. And any visual disturbances at all? Do you wear corrective lenses or?
I had
Eyeglass?
LASIK done a couple years ago, so not anymore.
Okay. So, I'm going to look and feel your head, and what you just have to do is let me know as if anything hurts.
Sure.
So I'm looking at the scalp, inspecting. I don't see any masses, swelling, equal hair distribution, not excessively oily. Just going to feel. Does any of this hurt, Jess?
Nope. Okay.
So there's no masses, no swelling felt. Excellent. So I'm just going to run my hand across your forehead. You're going to feel a light tapping. Does any of this hurt, Jesse?
Nope.
Excellent. So frontal lobe, there's no swelling, no masses. Going down to just on the sides of your face here. Just going to palpate your temporal arteries. They feel equal and strong. Just going to continue down the side of your face here. Any pain as I'm pushing?
No.
Down into your jaw. There's no tenderness, feels stable. What I want you to do now, Jesse, I want you to open and close your mouth and just have a feel, right? It's called your temporomandibular joint. Any pain as you're opening and closing your mouth?
No pain.
So TMJ is freely moving. There's no pain, no clicking. So next thing, I'm just going to listen to just the sides, right? Those arteries I was just palpating. All I need you to do is when I do put my stethoscope on there, I just need you to breathe in and hold your breath for a few seconds, okay?
Okay.
Whenever you're ready there. Left temporal arteries, no bruits. Right side, and again, hold your breath. Excellent. The right side, right temporal artery, there's no bruits as well. Okay. So this next thing, I'm just going to palpate again, just on your forehead. And all you need to let me know is if any of it hurts. So just palpating the frontal sinuses. No pain?
No pain.
There's no pain to the frontal sinuses. And just on your cheekbones here. Same thing, pain-free?
Yeah, pain-free.
So maxillary sinuses, no pain or tenderness as well. Now I'm just going to move into your ears, okay? First thing I'm going to start just by shining a light in them. I'm just going to palpate around the edges or feel the edges. Look inside the ear, normal hair growth. There's no exudate. No excess wax buildup. Just going to feel. Any pain? So there's no pain to the aura or pinnacle. There's no masses or obstruction in the left ear. Over to the right side, same thing, Jesse. Normal hair growth in the right ear. There's no exudate, no excess earwax, no obstructions. I'm just going to palpate. Pull down. Any of that tender? So there's no tenderness, no swelling to the pinnacle or aura of the right ear as well. Just carrying on, I'm just going to take a look at your eyes. Face is symmetrical. No smiling. Okay. So the next test I'm going to do involves your eyes, okay?
Okay.
Just going to move my chair up close. So I'm going to start by shining a light in your eyes, just from about 4 inches away, and all you have to do is stare at the back wall, okay?
Okay.
It's called a cornea reflex test. So the light is reflected in each cornea at the same location. The next thing, I'm just going to have my lovely assistant dim the lights here, if you could. What's going to happen here, I'm just going to shine a light and bring it in from either side. And same thing, if you just look at the back wall.
Okay.
Excellent, thank you very much. So both pupils are strict and accommodate seeing. Okay, so this next test, it's called hearing test. So what I want to do is called a whisper test, sorry. I need you to close your eyes, and you're going to cover up one ear, and then I'm going to whisper a word into your unoccluded ear, and you're just going to tell me what it was. So if you go ahead and just block your left ear, and you close your eyes.
Watermelon.
Watermelon, perfect. And same thing on the other side, Jesse.
Apple.
Apple. You got both words right. No problems there. Gonna continue. We're gonna move down to your nose. Any questions so far?
I know, yeah.
Okay. So all I need you to do is just look up for me. I'm just gonna shine a light up here. So there's normal hair growth, no obstructions, no deviated septum. Mucous membranes are pink and moist, and there's no excess exudate. Alright. So the next thing I need you to do, keep your eyes closed. Just checking some of your brain function here, some cranial nerves. So I'm going to touch it's either a soft or a sharp object just on a few different spots on your face.
Okay.
And I need you just to tell me if it feels sharp or soft, okay?
Okay.
So here we go.
Soft. 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 Soft.
Mm-hmm.
Soft.
Perfect, thank you. Okay, now this next test is called a smell test. So what I'm going to do is I'm going to bring 2 vials up to your nose with your eyes closed, and they're a common smell, or a common scent, sorry. And you just let me know what you smell, okay?
Okay.
So if you close your eyes, I'm going to bring the first vial up, just up to you. Sorry, if you just block your left nostril.
My left nostril.
Yeah. Let me know what you smell.
Vanilla.
Excellent. Alright, same scenario on the other side. Just block your right nostril. What do you smell?
Coffee.
Excellent. There's no obstructions breathing through each nair. You got both perfectly right. So next we're going to move to your your mouth. Just going to need you to open your mouth. I'm going to shine this light in there again. Mucous membranes are pink and moist. This guy has all of his teeth. No signs of gingivitis. No bleeding in the gums. Next thing I need you to do with your mouth open is just say "ah" for me a few times. Ah. Uvula is retracting, soft palate is visualized as well as a hard palate. Okay. A few more tests involving your mouth. Show me all your teeth. Awesome. Frown. I want you to blow up your cheeks and scrunch your face as good as you can. Make some wrinkles. Excellent. So, just going to put my hands on either side of your cheek, and I want you to push your tongue against whichever hand I have here, okay? So just on the left side and the right side. Awesome. Next thing I want to do, I'm going to try and pull down your chin. I want you to try and resist that. Awesome. So any pains at all when I was doing that?
No.
Okay. So carrying on, I'm just going to lightly feel your lymph nodes, okay? There's about 7 different locations. Just let me know if any of it's swelling or if it's tender at all.
Sure.
No pains there?
No.
So preauricular and postauricular, both non-tender, non-palpable. Under your chin. Submental, no pain. None of that's hurting.
No.
Yeah, not feeling any swollen lymph nodes at all. Just one more site just above your collarbones here, okay? Perfect. So no tenderness on any of those sites, Jesse?
No.
So next thing I need you to do, if you just look up, I'm just gonna have a look at your neck here. So trachea is, or the neck is symmetrical, trachea is midline. No signs of jugular venous distension. Just gonna have a feel. Start by just palpating your arteries in your neck here.
Attention engine for rescue on PC1 for reports of a 2-vehicle MDC, the intersection of 30th Avenue and Cornet Drive, Pampa 15.
Sorry, that's my ringtone.
Apologies, no problem at all.
I'll get that later.
So the right carotid artery is strong and regular. Make sure to not do both of them at the same time. Left carotid artery, strong and regular. I'm just going to put my stethoscope on your neck here, Jesse. Same thing as before, if you just take a deep breath and hold it. And breathe out. Same thing on the other side. So both his left and right carotid arteries are free of bruits. Next thing, I'm just going to put my hands on your neck and just feel for any pain or tenderness, okay? So any of this hurts at all, you just let me know. Equal muscle growth. Trachea is non-tender. Can you swallow for me, Jesse? So the thyroid gland moves up on swallowing. I'm just going to listen one more time, just over the middle of your neck. Just regular breathing. So equal unobstructed movement of air through his trachea. So for the next part of the test, Jesse, what we're going to need you to do is we're going to have to remove your shirt again.
Okay.
So if you want to go ahead and do that. No problem. You can leave those ones on if you'd like.
Okay.
So I'm going to begin by inspecting and looking just for symmetry with the shoulders. Shoulders look symmetrical. What I want you to do, Jesse, is I want you to try and bring your shoulders up against the pressure of my arms. Any discomfort or pain doing that?
No.
Excellent. I'm going to start by feeling. Any pain as I'm doing this? Excellent. And with the chest. Any of this tender? Have you ever had chest pain before, Jesse? Any problems with it?
No.
Any shortness of breath?
No.
Have you ever been woken up from sleep with shortness of breath?
No.
And how about when you're lying down? Do you ever get short of breath?
No.
Okay. So what I'm going to do now is I'm going to just lightly tap on some certain areas of your chest. Same thing, I'm just going to be listening, so you just breathe normally, okay? Alright, so normal percussion sounds over the chest. Now I'm just going to have a listen. If you just, some nice deep breathing for me. armpit there. And the other side. Excellent, so your lungs sound great. So the next test I'd like to do is I'm just going to require you to say one word for me. It's 99. And I'm just going to run my palms just down the front of your chest, okay? Just whenever I tell you, go ahead.
99, 99, 99, 99, 99,
And one more time.
99.
Excellent. So it's normal vibration with tactile fremitus. Okay, so I'm just going to do the same just on your backside, okay?
Okay.
So you lean forward a bit. Same thing, I'm just going to start with some light tapping. Any problems with your back at all, Jesse?
No.
Was any of this bothering you, this tapping?
No.
So normal percussion sounds with the posterior as well. And just once again, I'm going to have you say 99 as I run my hand down spots on your back, okay?
Okay.
Go ahead.
99,
Mm-hmm.
99, 99, 99, 99, 99.
Awesome. Now with my stethoscope, I'm just going to have a listen. Just nice, easy breathing. Equal and clear lung sounds throughout. So this next test, Jesse, all I need you to do is take a deep breath. I'm just going to push a bit of your back together and just a couple deep breaths. One more. So the right and left lung are expanding equally. And this next test is all I need you to do to start. I need you to take a deep breath and hold it, and I'll let you know when you can breathe out, okay? So it's called a diaphragmatic excursion test. It's just going to check the state of your diaphragm here, okay? So just go ahead and take a deep breath. And I'm out. One more time on the same side, Jesse. And out. So for the second part of this test, I need you to hold your breath once it's exhaled. So once you breathe out, just hold your breath for a few seconds, okay? Whenever you're ready. You can breathe normally, and we'll do it one more time. Okay, perfect. You can breathe normal. So diaphragmatic excursion test is 4 centimeters. Normal is between 3 and 5. So again, perfect. And while I'm at the back here, I'm just going to check your back. Back is symmetrical. There's no masses. Nothing out of the ordinary. Is there any tenderness as I'm walking my hand down the back?
No.
Excellent. So no swelling. No tenderness all the way down the cervical spine. Okay, so moving on. What I need to do is I'm going to listen to your heart, okay?
Okay.
So I'm going to start just by trying to visualize the apical pulse. If I could just have you lay back here, actually, that would be perfect. He's quick. So I'm visualizing and trying to see the apical pulse in the 5th intercostal space, mid-clavicular. Next, I'm just going to lightly put my hand on your chest, Jesse. So I can feel the apical pulse, feels strong and regular. Next, I'm just going to listen to your heart sounds, okay? I'm going to listen with both sides of my stethoscope. Again, just breathing normally. 2nd intercostal space, right by the sternum. Perfect. One more time. Okay, so all heart sounds are good. S1 and S2 is heard. There's no splitting. There's no S3 or S4. So I'm just going to move to your stomach, Jesse, and then we can have you put your shirt back on, okay? So with the stomach, the order is a bit differently. I'm going to have a quick look, and then I'm going to listen first. So the stomach is symmetrical. There's no obvious masses. There's no swelling, no redness. So I'm just going to listen over a few areas of your stomach, okay? Awesome. So bowel sounds are heard throughout. I'm just going to begin by feeling. I'm going to start light. So light palpation is about just 1 centimeter, and it's just to see if there's any tender areas. You just holler if any of this hurts, okay? Okay so far?
Yeah.
So no mass is felt, no tenderness. And the last thing I'm going to do is just some light tapping again, okay? And that's causing any discomfort at all?
No.
Have you had any problems with your stomach at all, Jesse?
No, I haven't.
Never had any stomach aches, nothing removed, I don't see any scars.
No.
And your bowel movements, say, pretty normal?
Normal.
Okay. Never had to take any laxatives, any herbs to help it along?
No.
And urinary, no pain when you pee?
Okay.
Doesn't wake you up at night, you don't have to go lots during the evening?
No.
Perfect. So we can have you put your shirt back on. Normal abdominal assessment. So I'm just going to be going down now. We're just going to start by doing some range of motion tests for your arms and your legs.
Okay.
What I want you to start to do is I want you to put your left ear to your left shoulder. Any pain? And other side? Good. And now just put your chin down to your chest and your nose up high. Any pains there as that's happening? Okay. So normal range of motion for his neck. Now we're going to just go with each arm. Might be easier if we have you stand up for this part. Push this back a bit. So for this next part, you're going to do it, and then I'm going to go through without you helping me at all, okay?
Okay.
So the first part, I just want you to bring your arms out with your palms down. Any discomfort? And down. And we'll change, go palms up. Same movement. Perfect. Now, hands in front of you, all the way up, as far back as you can go. Alright, and...
The stickers are pulling.
Oh.
It's really discomfort.
Ooh, that sounded like a good one. Alright. And sorry, and then we're going to follow through, and I want you to go back as far as you can go.
So start.
Yeah, up like this. Perfect. And back. All good? No clicking felt?
No.
And now that your arms are in front of you, I want you to bring your arms up, down, and have your arms in front. We're going to rotate our palms and back the other way. Any discomfort as you did any of that? Alright, so I'm just going to help you. I'm going to do all those motions myself. You just stay as relaxed as you can, okay? We're just going to feel how your joints are moving. So the shoulder joint on the right side is moving freely, no clicking, no pain. Left side now. Any pain?
No.
Joints moving freely, no clicking. Up to your side here. Again, the joints are moving freely. Alright, it's moving freely. So next thing I want you to do is I want you to bring your arms up against my resistance, okay? And resistance going down. Any pains? Okay. So normal range of motion in both arms. Just feeling the brachial pulse. Strong and regular on the right arm. Any pain on the right arm as I'm going down, Jess?
No.
Continuing down the forearm. There's no pain or masses, no lesions. Checking the radial pulse on the right side. Right pulse is strong and regular. So move to the left side. Any pain on the way down?
No.
So no masses felt, no swelling, no deformities seen. Skin is intact and normal. Feel the brachial pulse. Left brachial pulse is strong and regular. And down in your wrist here. Left radial pulse is strong and regular. So if you just put your hands in mine, Jesse, why don't you give my hands a good squeeze? Any pain? Excellent. Put your hands out for me. I'm just going to feel your wrists. Any pain in your wrist there? Or in your hand?
No.
Left carpal bones are non-tender, no obvious swelling or deformities. Metacarpals and phalanges, no obvious swelling, no deformities. Any pain? And no tenderness. Just going to check capillary refill in the right fingers. About a second. And in the left hand, capillary refill less than a second. Just going to feel your wrist here now, okay, Jesse, in your hand. Any pain?
No.
Just going to work through your fingers here. So the carpals and metacarpals are all, there's no swelling, no tenderness, no instability. Same in the phalanges. Perfect, thank you, Jesse. So I can have you sitting down now. Bring the chair up a bit. So have you ever broken any bones?
Nope.
Lucky guy. Play sports?
No.
That helps. So Jesse, for the next part, I just want to feel your pulses in your femoral area. So it's just kind of inner thigh. Is that okay?
That's okay.
So if I just have you lean back. The right femoral pulse is strong and regular. Now I'm just going to run my hands down your legs. Any pains? No. Just going to bring your shorts up a bit. No swelling, deformities, or masses. Skin is intact, not red. Feel the knee joint. Any pain, Jesse? There's no instability in the knee. Continuing down. How about in your leg?
Mm-hmm.
So both legs look symmetrical. No swelling or deformities in the right calf. And palpating the posterior tibialis. Posterior tibialis in the right knee is present, strong and regular. Moving over to the left side, just up on your inner thigh here again, Jesse. The left femoral pulse is strong and regular. Running down the leg. Any pain when I'm pushing there?
No.
Just visualizing the leg again. No deformities. No swelling or instability. Not tender. And this knee joint. Any pain? No. Alright, down to your calf. Any pain at all? No. No masses felt, no swelling, no tenderness complained of. Feeling the left posterior tibialis. Excellent. So I just need you to remove your shoes and socks here. We're getting nice and close. I appreciate your patience with me here. Have you ever noticed any swelling in your feet that seems like it shouldn't be there?
Nope.
Any excessive bruising you've ever seen?
I don't think so.
No clotting disorders?
Not that.
Alright, I'm just going to begin just by feeling the pulse on top of your foot. Dorsalis pedis on the left side, strong and regular. Any pain in your foot, Jess?
No.
Alright. Excellent. So tarsals, metatarsals, and phalanges are all stable. No crepitus, no instability. On the right side, dorsalis pedis pulse is felt regular, strong. Let me know if any of this hurts again. Both feet look symmetrical. There's no swelling. And in the right foot, tarsals, metatarsals, and phalanges are all stable, intact. No swelling, no deformity. So what I want you to do is I want you just to bring your right leg straight out. Perfect. And down. And same with your left leg. No pain, no trouble doing that at all? Okay. So the last few things, I'll just have you stand up again. Just get free of that bench there. So what I want you to do, hands out of your pockets. I want you to just bring your right foot up and down. Just do that a few times. Just checking your balance and coordination here. And when you're done with that, you just go with the left foot. And up. Okay. Any difficulties with that?
The first one was wobbly, but
Okay.
yeah.
And just a few more coordination tests if you do it with straight legs now. Excellent. And the left. So flexion and extension are all good. If you just move clear of the bench just a bit more, don't want you to hit it. I just want you to do the same series in the back. So just flex and down and the other side. And then just a bit of straight if you bring it back. It's kind of a tricky one. And then on either side, if you just bring it out to the side a bit.
And forward.
Just directly out to the side,
Oh,
yeah.
side.
Okay. So next test, you just close your eyes, and I just want you to stand, you're just gonna stand still for about 30 seconds, okay? Just go ahead, nice and relaxed. This is called the Romberg test. Just another check of your coordination, stability. So there's no excessive swaying. Stable, good posture. It's a normal curve to the spine. Alright, Jesse, thank you. So for the last test here for balance, I just need you to bring one foot up again, and I'm just going to lightly push on one side of you, okay? You just do your best to balance. One more time. Excellent. And the other side. Alright, good balance. So stay standing up. Just going to check your flanks here, and I have you in a good position. A light tap. Any of that tender?
No.
So no tenderness to either left or right flanks. Alright, Jesse, so that concludes the exam.
Okay.
You sit down here again. Any questions at all?
No. Questions?
So in review through the whole physical, I've found no concerns, no problems, nothing that I can report, and you have no concerns for me?
No.
No questions for me?
I'm not.
So as far as my end goes, I'd give you a clean bill of health,
Okay.
and we'll see you in a year.
Sounds good. Thank you very much.
Thank you.